My journey is basically at school. I was quite interested in medicine and biology, and taking biology for my A-levels, I just knew I loved the human body. That was when, yes, this is for me.
I love the comparison to trying to drink from a fire hydrant with a straw, except I add there's multiple fire hydrants coming on at any one stage and you're jumping between the fire hydrants. And it was, my mind had felt quite brainless when I started, and towards the end you go, holy hell, the brain starts to absorb and you absorb all this information. It's just incredible how the mind can expand.
Oh, coming home, right? Coming home, I grew up here, finished my high school here. I finished my medical training in China, but then I did come here to work. And after my public health training in the States, I came back here. That's when I worked for WHO and also AUSAID. That's just like a USAID version of the Australian government. So this is really home. All of my family is all here. I'm the only one in the States, and my friends.
Then, as I did my own research into everything, VCMP just felt like the right fit, because the main reason why I wanted to do health was to help, because then, I was seeing things like how my own grandmother couldn't get certain healthcare because she'd be sent from pillar to post, where she could have just got the same thing from one person. So I just felt like I want to be involved in that. I want to, make some kind of difference.
I had a woman with chest pain this morning. I referred her to hospital. And I had a young diabetic patient with appendicitis, which comes just, my assistant calls me and said, you have to do a visit at home. And so then I'm off, and you find somebody who's young and who's very ill and a lot of pain. And then it gives you a good feeling that you can, arrange things very quickly. And so within about 20 minutes you have the ambulance, and person is now in hospital. And later at night or tomorrow morning I will see his results and what's been done. That is what's in your mind all day, of course, these patients. Yeah.
By you telling them that you that is talking to them is also a survivor, you was in the same state, they are encouragingly, and they walk out from the ETU and they are back, psychologically is a kind of huge, positive impact, all right? They feel that, they can also be like you. And so our roles in there was actually to encourage, patients that you can make it, you need to be strong, you need to have the faith that you can make it.
You need to be passionate about your work. People are passionate about so many things. It may not necessarily be the job. The job may be a means of earning a living. They may be passionate about something which they do as a hobby. But to me, it so happened that my passion and my means of earning a living is the same. So I totally enjoy what I'm doing. But yes, you need to have that kind of a drive, that motivation, that interest into the job to excel and go raise the bars, go beyond what is expected out of you, and to gain that kind of satisfaction.
I enjoy my work. That's why I'm still in it. And at my age, that I still go to work every day and enjoy it is because, I feel like it's worthwhile, and I like to listen to people's problems and try to give them some direction so that they do have a healthy, long life, and it pays off. There's always those times when people come back and appreciate what you did for them, or sometimes you don't even know what you did for people and they come back and say, you remember, and you don't even remember telling them that or giving them that advice, and they come back later and thank you for that.
But it's like a routine. You come to work, you do what you need to do, and you get thank you from this, you get thank you from that, from this one or that one, doesn't matter. and you continue your day. At the end of the day, it's work. You're trying to do it as good as you can, as professionally as you can. And you're studying. You keep studying all the time. After you finish the work here, you go home and you read and you learn. I don't think it ever ends. There was a 60-year-old patient who came here with stroke signs, came with an ambulance, and I started managing him. I asked the secretary to hold the CT. I talked to the neurologist. I didn't wait for someone to take him. I took him myself after doing the examination. And we went straight to CT, and I met the neurologist at the CT. And after doing the CT, we decided to take him straight to the stroke unit and give him treatment. So in the evening, I got a nice call from the hospital, which said that there's no neurologic deficit.
So you felt you helped him out?
Yeah.
Does that feel different than from when you, let's say, worked in an ambulance setting? Or?
Here it's different. Most of the patients are stable. On the ambulance, a lot of the patients are unstable. So it's more intense.
Sleepy, confused, so I need to look sleepy. Confused, dry hair, hair loss, loss of outer third eyebrow, dry palms. Okay, so we'll do that?
Yeah.
Cool.
Sounds good.
It's been a while now. I've just been feeling kind of low and just I don't understand what's happening to my body. I'm just not feeling well.
Mm-hmm. Okay. So how long has this been going on for?
My work experience is actually mainly in Brazil.
Can you talk about Brazil?
Yeah, it's very, very different. It's a lot more relaxed there. I was so surprised at how easily I got work experience. I just met a nurse and I told her, I would love to get some experience in the hospital. And she's like, okay, I'll call a doctor. She called a doctor and was like, I have a friend that wants to, go to the hospital. And he was like, yeah, just tell her to come in. So I went in to his office, I met him. He's a cardiologist. And he was like, yeah, I'm in on Thursdays and Fridays at this hospital. You can just come meet me and I'll show you around. And I had the most amazing time. I turned up every week for about 10 weeks. And he just showed me everything. He introduced me to all the doctors in every kind of speciality. So I went through, nephrology. I did cardiology, acute medicine, surgery. But it's crazy because I just turned up and they let me see everything.
This is so tricky. Hypothyroidism?
Yeah.
Is it hypothyroidism?
Yeah.
Oh, okay, cool.
Hey.
Okay. Awesome.
I graduated in 2013, so I've been working since 2014 actually. Started out in a government hospital, which is very different to this setting, very, very different.
How so?
Yeah. In terms of the biggest one that stands out, workload. biggest difference there. In government, it's a little harder because they don't really know us, they don't know what we're doing, so it's always that thing of you need to first explain what we're doing, and then there's all sorts of misunderstandings and people feeling threatened mainly. Well, that's what I experienced, threatened about our profession.
Is there something unique about CAs? You have to be passionate or curious to really do well?
I would say you would have, I personally think that you have to have some kind of passion for this because it's so new, number one, and because of it being rural based. You trying to bring a difference, trying to bring a change. So you have to have that passion that you want to change something, that you want to help people. So at least some passion in that aspect somehow. Yeah, I think you'd need that. Yeah, most definitely.
I want to introduce you to Merel. Merel, she's a student and I'm her preceptor. She's doing a rotation here and she's following the Bachelor Medical Assistant. So in the Netherlands we have a PA program and you can get into the program if you have a bachelor in nursing or a bachelor in physiotherapy or a bachelor like you do, the Bachelor Medical Assistant. Yeah. But you don't know about that, that's the future.
Not yet, yeah.
Okay. Even met deze uitslag hoor. En nou, als je wil kun je met
What kind of patients do you normally have? Then mostly elderly, or?
I see all patients, so young babies to very old people. I visit people that are very ill at home. I help people when they are nearly going to die and to give palliation therapy. So in this practice there's actually not a big difference between the patient that I see or the physician sees.
Do you do a lot of work at home then, or like entering things on a computer?
No, we finish that here. Yeah, it would be possible, but no. Mostly I go home when it's all finished. Sometimes a little later than working hours. Yeah.
You like to keep it here.
Yeah, well, the administration you do, but the mind it goes home. You take it home sometimes. Yeah.
You know, this is what my boss tells me. So if you can harvest conduits for bypass surgery, why can't you harvest a donor heart for a transplant? So we are one of the most busiest transplant units in the country. And we do kind of around 70, 75 transplants every year. There's something called the superior vena cava and the inferior vena cava. So we have to have as much length of both of it as possible. There's always a tussle for the inferior vena cava because usually the liver is also harvested. So they also need a bit of the inferior vena cava. So there's always a tussle between us and the liver surgeons as to how much we have to cut, how much they have to take. There have been times when, you know, we had reached the donor site. We were waiting there. This was a 4-year-old kid. So we were seeing for a 3-year-old kid. So it's difficult to get pediatric donors. A brain dead donor, size matching for a young kid. So this kid was very sick, quite sick, and was waiting for quite some time. So we have to make sure that it is, you know, mutual. You know, we make a mutual understanding in the beginning that I'm going to cut here, just above the level of the diaphragm is mine, below the level of the diaphragm is yours. So sometimes in a kind of frenzy, at that moment we tend to cut a little more, and they kind of get a little. Angry at us. Initially we went and assessed, the heart was very good and it was kind of perfect match for this kid. This was a 3-year-old kid, 4-year-old. We thought, okay, jackpot, this kid is going to do well. This is very sick also. So that is where we do. So all the great vessels are chopped off, and the last to be cut out is the left atrium. So that is the posterior here, if you can see this area. So this roof part of it is left behind. And just at the level of pulmonary veins, we chop all the pulmonary veins and take out the heart. That's how we do it. By the time the process got over and the donor was ready to be shifted, the heart had completely deteriorated. So the function was too bad that it was not fit for harvesting. So this kid could not get that heart, and this kid didn't get any other matching heart.
Clinic for diabetic ulcer right foot, period. She'll increase her insulin to 20 units. She'll increase her insulin to 20 units, period. She has an appointment with diabetic education.
I enjoy the adult medicine. It's a lot of work because there's a lot of things you got to deal with in every visit. So it's not like a well child check where you just bounce through it and give them their immunizations and they're out the door. But here you got multiple things going on. Usually you got high blood pressure, you got diabetes, you got cholesterol, you got maybe a previous cancer, or you're working up some illness of anemia or something, and so there's always something going on, and a multitude of past medical history and ongoing problems that you gotta all work with. So I come about 6 o'clock in the morning. I start my chart work, reviewing my lab results, any patient calls from the day before that I didn't address, renewing medications, and then I look at my schedule for the day. And so then I start seeing my patients at 8 o'clock in the morning. And then I usually get an hour and a half to do that, to catch up at noon, and then I'm back seeing patients till 5 o'clock, and then finish up my day with my dictation and stuff. And usually I'm done by about 6 o'clock, so it's a 12-hour day.
And what are those?
These are eggs. One of our people that work here has chickens and ducks, and so I buy some from her every so often.
Can I see them?
Sure.
These are
duck eggs.
Okay. So what are you going to use them for?
Probably use them for baking, mostly baking. Yeah.
I was a paramedic. Started in 1987 after a couple of years post-uni. Loved the job. Started in Sydney. I ended up moving country. To go country, I needed to move to Queensland, and did nursing. And towards the end of my nursing degree, I heard a talk on PAs and went, oh, holy hell, that's what I want to be.
So how much are you limited compared to like an American PA?
Yeah. Where 90% of our stuff is just taking bloods, ordering, taking bloods, imaging, just that initial stuff. Yeah, people don't know what PAs can do, and until they do, and slowly, Mitch and I are just adding bits. And if you look at the other PAs throughout Australia, that just, and there's very few doctors that once they've worked with you and figured out what you can do, can't see potential. The light bulb. Oh, you could do this, you could do that. Perfect.
A medical assistant or PA, right? So in a Lao context, who worked in a health dispensary, needs to be able to do pharmacy, immunization, injection, prenatal care, all of this, because that's basically, there may be 3 to 5 of them in one particular, one health dispensary.
Did you have patients here?
Well, actually I just told my family that when I come back from Savannah Cape Friday that evening, I'm going to do a presentation on how to prevent, and then because really unfortunately a few family members already have diabetes. When I was here for public health, that wasn't a big deal at all. But with now that people are
more westernized,
you see all the food coming in, and then the knowledge about what's good for health, they kind of lag behind. Same thing, when what I saw in Guam, So there's this really big problem here. So I'm going to do that. So I'm telling them to tell friends, to tell anybody to come. So I'm going to do that kind of small talk to them about that. And that is something too, I really think in the future, to come back more and stay longer, would be focus on really educating people on this part too. This is more like a big
PA model works well here though, because it's more the primary care, work on cardiovascular disease, including diabetes and hypertension.
Right. So, yep, absolutely.
They're just like the rest of the world. They have problems.
Yep.
I got infected from a colleague of mine, a nurse. I can remember it was on a Friday night. I was on duty, and I met her in the ER, and I was like always going closer to her, doing her assessment, and I didn't know that I was playing with danger. And so after a few days, this lady died, and she was tested positive, of the Ebola virus disease.
One specific patient I interacted with, he was very ill, and I helped establish IV, and he died of the disease. So it was kind of alarming and frightening for us, for those who provided care for him. So I wanted to go to one of the Ebola treatment unit to get tested. But each time I would bring the idea, I would suggest the idea to my parents. They would flinch it away because the issue of Ebola at the time, the stigma was so very high.
And nobody, for the fact that community members know that you are in the ET, in fact, your family is totally been isolated. No one wants to speak to your family, and they call your family names, and you yourself being in the community, they call you by names. Oh, that Ebola boy, Ebola man, Ebola woman, Ebola girl. More besides, getting Ebola wasn't by, just a choice, okay? 99.9% of people who came down with Ebola were people that were providing care. They were helping someone.
I underwent treatment for like 2 weeks, and I came so very near, close to death.
For me, I was like admitted on the 28th of June at the GFK, at the old chloride unit. We had a chloride unit here, and I was actually released from that area on the 16th of July, 2014. And after my own release, a lot of survivors, PAs, went back and started to provide clinical care, psychosocial, health education, awareness, stigma and discrimination, and so on.
Do you like them less intense, better?
No, I did them both.
Yeah.
In my free time, I volunteer in the ambulance. We open an ALS ambulance. We do
You do both?
We do both, yeah.
You must be very busy then.
No, it's my free time. I enjoy doing it.
Okay.
It's like, I think it's a bug. You get it, then you can't dispose it.
The dynamism inside the theater is what attracted me to it. So every day is different, every case is different, every patient is different. You have to act as per the case. So that was very, very challenging. And I love challenges. So that's how I got into it.
So that the challenge and the adrenaline.
Absolutely, yeah. I didn't want to use the word adrenaline, but yeah, it's that adrenaline that keeps you going.
And we're starting to, like I do ultrasound guided cannulas, which not everyone does. So the patient we saw that I said hi to out the front there, she's a difficult patient with difficult veins, so she wants me to put a cannula in when I'm here. So.
And I don't think anyone would like to be a survivor. But you would like to be a survivor when you are infected. Yeah, so you see that once you are infected, you want to be a survivor. But I don't want never want to be a survivor. So I always told people that, you know, for people who sometimes look down on Ebola survivors, you know, I always told people this, and I think we can all live together, you know, and we can do better, you know, in one accord.
Next moment I was standing there in the big football stadium where the mayor of my town came, and well, I was really shocked. So they don't knight you with a sword here. It's just they put on this cross and that's it. Yeah. And it's family. Yeah.
Thank you so much.
You're welcome. You're welcome.
Enough. Well, you go first. The guest goes first. See how thick the yolk is, or the white. So it's really got to be beat. A little thick on the meat and the cheese. Is this healthy? No. Nobody knows. Duck ate from work, goes back to work. The energy to take care of my patients. Any leftover cholesterol medication I use.
But yeah, coming home to Lao food.
To Lao food, yes, that's the biggest thing we miss, yeah. It's good food.
Yeah, good food. Yeah.
I always hang out with Campo because she always knows where the good food is.
That's street food, right?
Yeah, we eat street food together.
Yeah.
I think you showed me that your favorite noodle place one time in Laos.
Yeah.
Now I can't stop going there. It's my favorite place.
Yes, my favorite place to go, yeah.
We need healthcare professionals, you know, we need to help the rural areas. That's where the most help is needed, you know. So I just hope it just grows as it is now currently, which I feel with Quality Health. Yeah, it's growing. Yeah. Thank you. I hope I did okay.
But so I'm really excited so I'm a first year student and I'm really excited to start next year going to placements.